Hi, I'm Tran Bowie. Thank you for joining us. So being at home has been a big adjustment during this pandemic. We are spending a lot of time in front of our computers and in front of the television. Plus, we're not even able to see our doctors. And that is why we're having all these aches and pains, and it's really taking a toll on our bodies. Here with some relief is Dr. Tannaz Modaresi. She is a chiropractor and also the owner of Injury and Wellness Specialists of Georgia. Hi, how are you?
Hi, I'm good. How are you?
I'm doing well. It looks like you're back in the office, but being back in the office means you have new safety precautions. So what are some things you're having to do now to be able to see patients?
We make sure we send email out and ask all the clients to have the mask on when they're coming. And if they forgot, we provide it to them. We have a screen paper that they fill out for us. So we ask if they've been close to anybody, had COVID or any fever recently. They fill out a screen questions, and then if everything is good, we get them in. We ask them to sit in a car and not be crowded here. So we schedule just kind of one patient at a time. We bring in, and then we clean with disinfecting after each patient, and we all have a mask, and we're doing good.
Yeah, it sounds like you're doing all the right things. I know that this had probably taken such a big toll. I mean, you're still a small business and you're not able to see your patients. How are you dealing?
Yeah, we got a couple called as emergency. They've been in pain. They try to keep it as much as they can, but we got some clients that they've been in a lot of pain, and I try to come and see them. But yes, being on a desk, a lot of clients work at home, and that's really make it difficult. So.
Yeah, so it looks like even though you were closed, that you were able to still see your clients, and I think that's great that you're still able to stay in touch. And this is something you were talking about. We're in front of our desk, and something we probably didn't think about is all that time at home and this new way of working and staying at home probably created some new aches and pains. So what are some of the common complaints that you're hearing now because of the quarantine?
We get a lot of, back pain is always there, but it's just getting worse. Believe it or not, these days we're hearing like elbow pain and wrist pain as well, just because the way they sitting at the table, not doing it right way. A lot of neck pain. The people get strained because of looking down, not having a good posture while they're working. Some people really work 8 hours at home on the kitchen table, which is not really do them a favor. So we get more complaint of a back pain, neck pain, and wrist these days.
Yeah. I'm definitely feeling that pain on my wrist. I feel like I'm spending a lot more time on the computer, and because we have more time, I'm not taking as many breaks. Is that something that concerns you and other chiropractors? Is this extended use of technology that now we're having, not just during the quarantine, but possibly even after?
Yes, it's really we're really concerned because a lot of people have already a disc problem, like on they've been getting taken care of here, and everything was under control. We do this decompression on them, which that's really helped them a lot. Not coming here and trying to sit a long period of time is just, of course, is going to make it worse and worse. So we try to get in contact with everybody, talk about exercises and what they can do online at home, and we get the telemedicine talk with them and show them how to do it. And that looks like it's getting a little bit more controlled that way. But we really want them to come back as soon as they can. Of course, they have to feel safe. But if we stay in a long period of time, we have to go back to the first place we've been. And we really work hard to get them to maintenance. So hopefully.
Right. And that's the thing with your current patients. They haven't been in to see you for so long. And now, how serious is possibly the damage that they're having from not being away, not being with you or seeing you for this extended period of time?
Yeah, it's just getting sometimes. If they're not listening, they don't do the right stretch, not good posture, not the good way of sleeping. It's gonna damage.
Yeah, so let's go into that. We actually have some viewer questions. We talk about realignments, but then there are probably some home exercises that we can also do in between these visits with you. So Michelle Thomas is asking, what examples of chair exercises would you recommend? And how often should we do those exercises, especially if we're sitting all day?
So the first thing, you're gonna make sure, let me just talk about how you're gonna sit on a chair basically. You're gonna make sure your back has a good support, and then you're gonna make sure your feet is flat if it's possible on a floor. We're gonna make sure if you work on a computer, the computer monitor is actually level with your eye or a little above it. And if you want to, because otherwise you're going to get slouched down, and that's not good for your body. So the best kind of exercise you can do while you're working, honestly, it's doing like work like that, like going back, hold it, let it go, and then doing it again. If you can often walk around, like after 30 minutes, 1 hour, a little bit walk around and come back, sit, that would be great. For the shoulder, if you can do while you're sitting any exercise like that, basically shoulder up and back, that really feels good. Those is what you can do while you're sitting. Ergonomic chair, it's very popular these days. Kneeling chair are very popular. They're all helping with the back pain as well, if it's possible to buy it.
That's so helpful, because I mean, even as I'm talking to you, I'm trying to stand up straight because my back is let's get in there. And you were talking about the computer. Angie Santee is asking about the desk setup. And you're right. A lot of us are now taking our laptops and moving them into the kitchen. And I did the same thing, but I have moved into an office. But she is asking about some important factors, like the best, you were talking about the best computer placement and also your height. And what about those detached keyboards?
Yeah, if you use a laptop, it's better to have a detached keyboard because you want the keyboard and a mouse to be very close to you and as low as possible you can go with it. Just because that's why we get the elbow pain and the wrist pain. They're not in the right position. You want to be in the right position. You want the shoulder be relaxed. So kind of hands down as much as possible and in 90 degrees between here and here, and you want your wrists to be straight on the table. So if you can bring it down, that would be great, and close to your body as much as possible.
Okay, that is good to know, because I recently moved, because I do have a laptop and I had to get a mouse because I felt like my wrists were just like all turned up.
Like that's not gonna work.
Okay, I'm changing that. So Ray Baker is asking some of the best ways to stretch or treat sciatica from flaring up. And he says that he can turn his head further to the left than to the right. So what do you recommend to improve mobility in the neck?
Yeah. It's very hard to tell you from just, from here, like what can you do for sciatica? Because sciatica, we have two kinds of sciatica, true sciatica and false sciatica. It's always important to know what kind of sciatica it is. But as an exercise, just to tell you what to do to get rid of the back pain a little bit, it's every morning when you wake up, if you bring the knee one by one to your chest, hold it for 3 to 5 seconds and let it go. Do 5 each leg. And then after that, do both of your legs, bring it to your chest and hold it the same way, 3 to 5 seconds, let it go, repeat it 5 times. That kind of relieving the back pain in the morning. As I said, the sciatica is a different sciatica. I would love to talk more with Ray and about it and see what kind he has, and I can help him more that way about it. But this is this first step he can start with. For the neck, when it's turned to one side more than the other, it means it's a spasm in one side more than the other. So the reason is probably the pillow is not comfortable, the way he sleep at night. Make sure you don't sleep on your stomach, because stomach, imagine your head is like that all night. So about 8 hours a night, hopefully you have that 8 hours sleep, but imagine you're like that. So that causes a lot of pain and I mean stiffness actually in one side than the other. So make sure you sleep right, sleep on your back if you can. That's the best thing for your neck. And as soon as you can come here, I will adjust it and we get back to the alignment, and it's going to be way better. Exercise for your neck, I guess honestly what I can do here without knowing what kind of problem you have, it's the best one is range of motion. So like you bringing it down, holding it for a little bit, like 3 to 5 seconds, come back to neutral. Yes. And then you can do the same way backward and then come back to neutral and lift the same back to neutral. And then the other one, you can do 5 each side. And every time, don't do like this because that's not a good way to do it.
Right.
And then and if you have pain in any of those movements that I'm talking about exercise, but if you have any pain experience on those, please stop and not do it. You can give me a call, let me know I have pain with this one, and I can tell you what to do. But we don't want to have pain and do exercise. So
okay. That's good to know. So Ray, if you're listening, please give Dr. T a call because I think it's best to see a professional. And you were talking about sleep. And I know a lot of people may be having trouble sleeping right now, especially during this pandemic. So you say don't sleep on your stomach or your face. So what is the best way to sleep and what can we do to help our sleep?
Yeah, number one sleeping position is to sleep on your back. That's really helping with the relax your neck. And for your back, you can even have a big pillow under your knees. That will help a lot to get the pressure off of your back as well. If you're a side position sleeper, make sure you have a good pillow that actually and they're selling the pillow that has a curve a little bit in it. Those are really helpful when you sleep on a side or on the back. It's help your neck to be relaxed. And if you sleep on the side, it's important to have a pillow between your knees. That's very helpful on the back pain as well.
Okay. No, that's really helpful. And this is such great advice, but when should we actually go and see a chiropractor? When does it become serious enough for us to come see you?
Okay. When is in a normal situation, when you start having pain, we would love to see you, and don't wait with pain. The people say like, hey, I'll get better. And you might get better of a pain, but the real root of the reason of you have pain is not going to go away. And that's what we do as a chiropractor. We really find the root and we try to diagnose and do the treatment the way it goes with that problem. Okay, so that's the thing. If you get it, don't wait. Don't have some medication and say it's gonna go away. Just come to us right away. But in this situation, though, you have a quarantine time. Just if you see if it's more than 6 weeks and it's not gonna go away, it's kind of chronic, stay there, the pain, please come. Because if you stay longer, it's just gonna make it worse and it's harder to fix.
Yeah, I was worried about that too. Okay, and we have one last question from Lynn McDonald. She's interested to know if you have experience with treating hormonal fluctuations with adjustments and can it help?
Well, this is what we do all the time because nervous system and endocrine system and immune system is like a triangle. So each side of the triangle is each one of them. So they all kind of connected together. When we do adjustment, we help to get the pressure off of the nerve, because when you get misaligned, actually it is the pressure on a nerve. And when we adjust it, we help to get pressure off. So when the nerve works right, endocrine system, which is responsible for hormonal, are working fine. And immune system, it goes high too. So it's kind of all connected together. Definitely, I mean, I cannot say a specific condition that I treat of a hormonal fluctuant. This is what we do. When we do adjustment, the hormone going to be balanced. So,
okay.
Yeah.
That's so helpful. All right. So I want to wrap up by talking about what your schedule is like now. So if we need to make an appointment, what needs to happen and how do we go about getting in to see you?
Yeah, we are opening back very slowly. So we are 10 to 3 Tuesday through Friday. We are closed Monday and weekend at the moment. But you guys can call 770-800-1000, and we have a 24/7 answering system. You can leave a message what time is good for you, and we look at the schedule. We will give you a call back in 10 minutes. After that, you guys can visit our website, injurywellnessspecialist.com. You can ask for the scheduling. It's a scheduling section that you can actually send which time is good for you, and we can work that out that way as well.
And I also like that you have a Spanish-speaking staff, and so for those who do need that service as well.
Yes, we speak Farsi, Spanish, and English. So welcome to call with any of those languages. We can take care of you.
Yeah, so don't let that stop you from calling. Thank you so
sorry.
much for all you're doing, and welcome back to business again.
I'm happy to be back.
Thank you. Have a great day.
Thank you so much. Appreciate having me. Bye.